Hi, so the patient that we're going to see today is a 25-year-old female who was transferred to a rehabilitation hospital yesterday. She suffered a traumatic cervical spinal cord injury 9 days ago in a motor vehicle accident. She has an ORIF to help stabilize and decompress the fracture site utilizing a right iliac bone graft. So to start her treatment session, we are going to start with passive range of motion to the ankle. This is just to help address two things. One, because she has an ORIF, she is at an increased risk of a DVT. So we will use passive range of motion to the ankle to facilitate muscle pumping, just to get the blood to her lower extremities moving, since she's unable to move her lower extremities at this time. And two is to increase range of motion to both of her ankles. She lacks 5 degrees of dorsiflexion to neutral. From there, we will continue with passive range of motion to the lower extremity, just to help help decrease contractures and to maintain her flexibility, so that she's able to do long sitting, and also will help with transfers and dressing. From there, I will move into passive range of motion to her upper extremity, mainly focusing on external rotation. This is just to help with locking out her arms when she's sitting up from supine to long sit or short sit. That will also increase her base of support and help with transfers later down the road. And her chart also stated that she needs assistance sitting from supine to long sit, and that she's only able to sustain her sitting position for a minute. So to address this impairment, I will help the patient sit from supine to long sit, and while we're there, we're going to do weight shifts. This is just to address two things. One will be to increase her long sitting endurance, and two, because she is a C7 spinal cord injury, she doesn't have her core to help maintain her balance. So when we're doing weight shifts, it's just going to help her relearn how to gain her balance. So when she's coming off balance, she can regain it without using her core. And the last thing that I'm going to address is focusing on her upper body strength by utilizing shoulder decompressions. This is just to help strengthen this motion here, so that she's able to transfer from the bed to her wheelchair, or from the wheelchair to the commode later on down the road. So we're just starting out with a good strength basis. So that's what I have planned for our patient today. So now let's go meet Ansley. Hi, Ansley. I'm Caleb with physical therapy, and I'm going to be working with you today to get you back to being more mobile. All right?
Okay.
So first of all, does that feel comfortable?
It's a little up there. Yeah, that's better.
Okay. So first of all, I'm going to work on your ankle range of motion, because you're a little short of where you're supposed to be at with your neutral, and you also have an ORIF, so that's also an increased chance of blood clots.
Wow.
So I'm going to do some pump your ankles for you, so we can get the blood moving down here in your lower extremities. You've been a little immobile for a couple of days.
Yeah.
Good. Alright, so now we're just going to do some range of motion with your knees. Good. So this also is to help you stretch your muscles still, because since you've been immobile for a couple of days, so we're getting the muscles loose. And I know that right now you can't move them because of your injury, but we still need to get some range of motion in there, so we can help you with your transfers later on down the road.
All right.
now I'm going to work on getting stretching your hamstring. Okay. So this is also for transfers. You have to have a certain degree of range of motion, so we can move you around. And also for you, you become more independent. You can be able to dress yourself. And that's always a goal.
Yeah, that's a good goal.
Yeah. Alright. Alright. Good. So now I'm going to come over here and work on your range of motion in your arms, because you're going to be relying on these a lot now.
So that's going to help me move?
Oh, absolutely. Makes you more independent as well, because you're going to have to use a lot of rotation to lock your arms out. Good. And you don't have your fingers either, so I'm not going to work on them. Alright. Gotta make you symmetrical over here. Yeah, you are a little tight up here too. We'll be working on this.
That's a little tight.
Yeah, we'll be working more on this later on down the road. Alright, so now what we're going to have you do, we're going to try to get you up for a little bit and get you in long sitting, okay? So you're going to have to tell me how you're feeling. So first of all, I'm going to see, can you bring your elbows close to your body? Bend them for me. Good. Now I'm going to have you, can you push your weight through your elbows?
Mm-hmm.
Okay, go ahead. And we're going to sit you up. Good. Good. And walk your elbows back. Excellent. I'm going to have you put your hands on the mat. Good. Good. I'm going to have you, can you push your weight through your hands?
Mm-hmm.
Good. Push up, and you're going to sit up. Good. All right, how you feeling?
A little tired.
A little tired? We'll hold you right here. How's your head? You feel faint, dizzy,
No,
nauseous?
I'm good now.
All right. So now I'm going to have you walk your hands back a little more. Good. Excellent. So now I'm going to have you work on some weight shifts right now. So you're going to be maybe a little off, because you don't have your core to help control yourself. So you're going to have to relearn that center of gravity through with your arms. Good. How you feeling?
Pretty good.
Alright. So, have you pause real quick? Alright, now let's work on putting you back down. So I'm going to have you bend your elbows, lower yourself back down to your elbows. Good. And you're working your triceps, okay? Excellent. Now with your triceps again, you're going to have to lower your lower half of your body down, okay?
Okay.
So control, back down to the mat. Good. Excellent. So I'm going to let you lay here for a couple seconds to regain your breath and let your muscles relax. And we're going to sit you back up again and do another activity.
Okay.
The blood back in your head?
Yeah.
Okay. Alright, let's go again. So remember, you're going to push up through the elbows. Good. Alright, you're going to flatten these hands back down. And you're going to push up through the hands. Excellent. Beautiful. Beautiful. Ah. Alright, now, so what we're going to do is I'm going to see if you can push your body, your weight through your hands to bring your upper half up for like your, good. Good. So we're going to do that's 2. Give me 3 more. Good. So this is going to be good for when you're transferring to your wheelchair, transferring into movie. We're going to learn how to shift your weight over in the future. We're just going to take another break and we're going to do 5 more, okay?
Okay. Can I go down?
Do you need a break?
Yeah.
Absolutely, yeah. So remember how to do that? Good.
Bring it in.
Slowly lower yourself to your elbows. Good. Excellent. This collar. There you go.
Okay, I think I'm ready.
You ready? Excellent. All right. Pushing up through your elbows. Good. Excellent. Push through your hands. Good. Good. Look, you already got more range of motion with the external rotation. Now give me 5 more. Good. 4. 5. Good. All right. Now lower your back down. Good. Slow. Down the elbows. Good. Bring it back down. Excellent. Good job, Ainsley. How are you feeling?
Feeling great.
Yeah.
That's a lot of work.
Yeah. You look like you're doing well. We're going to have you up and rolling in no time. We just got to wait until your ORF heals a little bit more. Any questions for today?
Nope, I think I'm good.
All right. We'll see you next time.
Okay, thank you.
You're welcome.